Well, as Singapore International Water Week gets underway, the World Health Organization has released its latest global guidelines on drinking water quality. Now, the health body says climate change, urban growth, and aging infrastructure are putting growing pressure on water supplies across the globe. The WHO says 2.1 billion people worldwide still lack safely managed drinking water. And that includes 106 million people drinking directly from rivers, lakes, or other untreated sources. WHO says their revised guidance places greater emphasis on preventing contamination and, of course, reducing the risk of waterborne disease. So, what are the biggest threats to drinking water safety today, and how significant are these changes? To answer them, we're now joined by Bruce Gordon, Head of Water, Sanitation, Hygiene and Health at World Health Organization. Bruce, thank you so much for joining us. It's a very important guidelines. It's coming at a very crucial point in time. We were just speaking earlier. Can you tell us why it's coming at this point in time?
Well, I think one of the things we have to remember is there are traditional risks that are exploding still. For example, if we look to some of the most vulnerable countries and regions in the world, you see emergence or resurgence of cholera, for instance. So that's a very, kind of extreme example. But all over the world, we're facing, I think, new threats, new emerging contaminants, and there's public concern around them. Things like microplastics, things like PFAS, the forever chemicals, pharmaceuticals in drinking water. Some of it's driven because we can detect these at very, very low levels. But operators and regulators need to know how to manage them. They need to know how to prioritize risks. And consumers play a role as well in terms of, using less water when there's, water scarcity, for instance.
But what about nations where water is already scarce? What about people who are not aware of how they need to do or what needs to be done?
Yeah. Well, I think there's always options. It's true that if you look at areas where there's the most waterborne disease, and you mentioned this 2.1 billion figure of people without, there is 1.4 million people dying every year. So that's fairly significant. And people in those areas, sometimes they're in small communities, and the systems are either there's no system or they're not really run by professionals. But they can treat their water at home. You could boil water. You could essentially put water in a discarded bottle and put it under sunlight and disinfect it. Those aren't real solutions in the long term. At the end of the day, I don't think we should be worried about water. We shouldn't be drinking water, worried about managing it ourselves. But there's always something to do.
Yeah, you mentioned the 2.1 billion number, right? Even after years of global commitments, why is the gap still so large?
I think that's a really good question. We see the trends are going in the right direction, but just slowly. So I think the gaps are still, obviously a huge lack of investment. The investment quantification is still really big. But ultimately, I think it comes down to, like all things, political will, but a governance issue. So we need all systems working together. We need to have regulators prioritizing the right parameters, so not focusing on, not being overwhelmed by, say, 100 potential contaminants. Thinking of the big things, we need to be prepared for climate risks, because ultimately there's three things that are, I think, facing us right now. Too much water, floods, too little water when we have droughts, and too polluted. And the too polluted is very interesting because, that's coming from industry, that's coming from agriculture, that's coming from untreated wastewater or poor sanitation, and that's poisoning our water.
Absolutely. And I want to pick up the point about governance over here. What's really stopping them? Why is there a lack of investment or interest, rather, in making the situation even better?
Well, I think at the end of the day, there needs to be some sort of cost recovery to this, in the sense that if you are providing water, if you're, say, providing water to a big city, you need to have the funds to be able to maintain it. You have population growth, you have water leakages, you have tariffs that aren't necessarily being paid because folks are not connected to the system. So I think that it's a very complex situation, but ultimately it comes down to all the way from sort of planning to essentially this idea of surveillance and making sure that you understand where there's health risks, where people aren't getting connections, and prioritizing where it is needed most.
Yeah, I'm going to ask you a very perhaps technical question here. You stress prevention rather than crisis response in some instance. What does it really look like in practice for a water supplier, before water really reaches someone's tap?
Yeah. Well, I can give you a very simple example of prevention. I mean, just imagine living in a small community and having a well, depending on your water from a well. And if you don't have a fence around that well and protect it from, say, livestock coming in, and then, sorry to use the word excreting, but that is the root cause. We talk about fecal oral disease, so that's the chain. So you can protect your water. And then if you look at a big city, it does mean ensuring that land use is done properly, that you have agriculture, for instance, that's not kind of the source of all this diffuse pollution, and industry that's properly regulated. So all these sources of pollution are very, they come from different places, they come from different sectors, and that's why we need to have this governance, because you can't just treat away all the problems. You can't just be sort of thinking, okay, we're going to, solve this when it's too little, too late.
Yeah, and it might be very late in some instances. Microbial contamination remains the biggest health risk. It's also mentioned in the report itself. With floods and droughts, conflict really affecting water systems, right? Are countries really prepared for that scale of threat?
I think many countries are doing like the necessary, because at the end of the day, like I talked about complexity, but you need to filter water, you need to protect sources, and you need to disinfect water, sometimes with chlorine. And when you see these outbreaks of disease, some of those very basic prevention and protection measures aren't taking place. So I think that there is that capacity to do it, but it's just ultimately sometimes doesn't happen because sometimes it's lack of supplies, but sometimes it's lack of a trained professional, and sometimes it's just that they're not being able to like actually work through the risks and understand, oh, actually, in this situation, we've had a contamination event that goes undetected or detected too late, and people start drinking it.
This guideline is something that you're refreshing or making it more current in that sense. It's been there. I just want to compare it with the previous edition of this. How different or how far have we gone? Are we getting any better? How long is it going to take to close this gap that we are discussing right now?
Well, I mean, I think it's something around we need to progress at a trajectory 8 times as fast as we're doing if we want to meet the Sustainable Development Goals for 2030. So that's it. We need to really close the gap. But I think as far as the differences in the guidelines, I mean, they are about health protection. So I think part of it is ensuring that we prioritize those areas. For example, small water systems, those are a cause of outbreaks in even the most developed countries. And there's tools and approaches that both regulators and local community can do to make sure that people are not getting sick from small systems. So those are one thing. Another thing is just, if you have a vaccine, it's for one disease. Now, there are, if you talk about microbial contamination, there's 20 plus, for instance, microbes that are, microorganisms that will make you sick.
Yes.
And so if you have a good water sanitation system, you can prevent all of those. And we've done extensive work now to kind of characterize the transmissibility of each of those, kind of 20 plus pathogens. So to try to better understand what kind of treatment needs to be applied and what measures need to be taken so we don't get sick from any of them.
Yeah, and I think we're at this point where responsibility comes in every direction, governance, people, everywhere. The awareness has to be there. Thank you so much for joining me in the studio, explaining all this to us. We were speaking to Bruce Gordon, Unit Head of Water, Sanitation, Hygiene and Health at the World Health Organization.